ttalk Boond Soch ki. We have got Dr. Sanket Mehta. He's a well-known name in the country in the field of Cytoreductive and HIPEC surgery, and also the president of the Society of Peritoneal Surface Surgical Oncology of India and a director of SSO Oncology Hospital, Mumbai. So welcome to this show.
Thank you.
Now, normally, whenever the patients they come to you, there's a fear factor as for the cancer which are concerned, which is often seen as the death sentence. So, is that perception still valid today?
So, the treatment of cancer has progressed dramatically since, say, perhaps 2 or 3 decades back. Not just in the field of surgery, where surgery has become much safer and much more advanced. We also use minimal invasive techniques to operate, so the recovery is faster. But even in the fields of systemic therapy, like chemotherapy, now we have targeted therapies, immunotherapies, CAR T-cell therapies, etc., which dramatically has improved outcomes, not just in early stage, but even in advanced stage cancers.
And doctor, in simple language, what exactly happens inside the body when the cancer develops?
So, in the human body, on a daily basis, we develop thousands of abnormal cells which are recognized as foreign or abnormal by the immune surveillance, the immune cells of our body, and are destroyed. At some point, either because of a driver genetic mutation or because of exogenous factors, or purely because of a sporadic incidence, as in a random event, some abnormal cells are not recognized by our immune surveillance, and these start growing and develop a group of cells called as a cancer, which can then either keep growing in the same spot or spread to other organs by the bloodstream or by the lymphatics. That is precisely what cancer is.
Is early detection still a challenge as the cancer which is concerned?
So while we have a lot of modalities which are available for early detection, the problem is that early detection, when the cancer is at an early stage, there are no symptoms. So the patient has to actively seek out investigations to diagnose a cancer. Unfortunately, in India, we do not have any screening programs apart from cervical cancer screening. Whereas several cancers like lung cancer, colorectal cancer, stomach cancers, etc., are detectable by screening programs which are there in certain other countries but not in India, which is why early detection is still a challenge.
And doctor, what's the first emotion when you see somebody coming with fear having cancer so what is that which you see and what is the response to that?
So I personally think that we have to process it as any challenge that you see in life, be it like a challenge in business or studies, etc. It's like an exam, and you have to prepare and cross the exam. That's how we should approach a malignancy. I don't think there is being overly emotional or analytical about it is going to change anything.
So now, when we talk in terms of positive mindset, is it a myth or normally it's an actually which influence the curability of cancer?
So for sure, it affects the recovery of the patient. Having a positive mindset ensures that the patient goes through the treatment with lesser side effects and with an earlier, faster recovery. It's also very important for rehabilitation because some of the treatments can be slightly debilitating, and to come back to normal life, to come back to going back to work or etc. requires a positive mindset and an approach which ensures that the patient can overcome. So definitely it helps for the recovery of the patient.
What is the one thing which you would like to tell to the patient, about once the fear of cancer comes in his mind?
I think we have to realize that they are not alone. There are doctors on their side, there are family members on their side, and they have to realize that there is 1.4 million people getting that same disease every year. A vast majority of them do recover. So we have odds in our favor now. And I think the fear is, while it's natural, but it is not essential for the patient to recover.
Okay, good, great. I think the great insights to what we are getting from Dr. Sanket Mehta, exclusively on ttalk Boond Soch, the president of the Society of Peritoneal Surface Surgical Oncology of India, and also Director of SSO Super Specialty Oncology Hospital in Mumbai. So thanks a lot. We are going to catch up with further discussion on technical aspects in our next show. Thank you very much.
Thanks.